All right, Nico, can you say, welcome to another episode of Healthy Births, Happy Babies?
It's a happy episode. Happy babies.
Hello and welcome back to another episode of Healthy Births, Happy Babies. I'm your host, Dr. Jay Warren, and this podcast, as you know, is all about healthy pregnancy, safe, gentle, natural childbirth, and taking care of our kiddos on the other side of things. We're over 100 episodes now. I want to thank all of you for your ratings and reviews in iTunes and elsewhere. I love the feedback that I'm getting with those ratings and reviews. It helps me keep going, so thank you if you've done so. If you haven't, please rate and review there. It helps our reach and get this podcast out to more people, and when people are searching for it, it's much more likely to come up so they can get the information that you've been helped with, help them in their parenting journey as well. And I also appreciate all the feedback I get about new topics that you haven't heard yet on the show and would love to learn more about. So that's always really helpful as well. And part of the feedback that I've gotten from you listeners is prompting this show today. We're going to be talking about the Pediatric Alphabet Soup, which, is known with your ASD, the ADHD, the LD, SPD, all these diagnoses that are going around with our kids right now that used to be known more, or kind of still is known commonly as on the autism spectrum disorder. But now we understand that even autism is placed in a bigger perspective and really is called the neurodevelopmental spectrum, which all of those hyperactivity, learning disabilities, sensory processing disorders, autism, all of those type of diagnoses are now placed on that spectrum. It's becoming more and more common, these diagnoses. More and more kids are being challenged by that. And I'm bringing on Dr. Drew Rubin today to talk about this. He has a course that he teaches called Pediatric Alphabet Soup. He's an expert in this. He's been working as a chiropractor, as a pediatric chiropractor for 30 years. But because this problem has become more and more prevalent, his practice has really specialized in this. So not only is he seeing it day in, day out, working with parents, but he's also teaching other doctors on how to recognize it and how to work with these kiddos so they can function more optimally. So I'm bringing him on the show today to help us navigate all of this. One, to give an overview of what these things mean and what's common misconceptions and what's truth, and what you can do as parents to start recognizing these things and where to be able to get some information and help for your kiddo if you're starting to sense these things. But even more importantly, and this is what this show is all about, is how to prevent it. If you're in your pregnancy, if you're in the newborn world, things that you can do to help their neurodevelopment so that these things are much less likely, I should say, to affect your kiddo. So before we switch over to that conversation, as always, let me take a quick message and then we'll come right back. Hi, it's Dr. J, and I am so excited to announce to you that my new online program is now available. It's called Connecting with Baby During Pregnancy, and what it's going to do is going to teach you methods proven by the latest research in pre- and perinatal psychology and epigenetics that are going to allow you to have not only a calmer and more relaxed pregnancy and to have a gentler, more natural birth, but on the other side of things, you're going to feel more confident as a mom, and you're going to be able to soothe your baby that much easier, because when you're able to bond with baby and connect right now during your pregnancy, it's only going to translate on the other side to just being that much more connected and be able to help them calm and soothe. It's a really important thing. So head on over to drj.warren.com/CWB, that's Connecting with Baby, and you can learn all about it. Dr. Drew Rubin has been in private practice since 1989 and is adjunct faculty at Life University College of Chiropractic, where he teaches Pediatric Diagnosis and 3 other pediatric courses. Dr. Rubin has earned the Certified Chiropractic Sports Physician title and is also a board-certified diplomate in chiropractic pediatrics, which he earned from the International Chiropractic Pediatric Association. In addition to 8 pediatric papers being published since 2007 in chiropractic journals, he's also written 3 chiropractic novels, including The Adjustment and its sequel, The Acceptance. He's honored to be one of the instructors for the ICPA and has spoken over 75 times in the last 5 years at places all across the U.S., Canada, and abroad. Dr. Rubin is also the host of his own podcast called ChiroCast, which is especially popular at chiropractic schools around the globe. He lives in Marietta, Georgia with his wife, Lisa, and his son, Palmer. So right now, let's switch on over to my conversation with Dr. Rubin. All right, Dr. Rubin, welcome to the podcast.
So happy to be here. Thanks for inviting me.
Yeah, well, I'm really excited because I've known of you for a long time. I mean, I've been a member of the ICPA and studying the courses, and I've known of your course along which we're going to be talking about today, talking about the neurodevelopmental issues with kids. So I've known of it. You know this, but I'll tell my listeners, I've not taken your class yet. So I apologize, but I'm going to learn a lot today. But it was in just the last month where we were both speaking at the ICPA conference in Washington, D.C., where we finally got to connect in person and had a nice lunch sitting together with your wife and talking about all kinds of different things. And I'm really excited that you took time to share your just wealth of knowledge that we heard about in your bio today, so our parents can get some more information about our kiddos and help them that much more. So I want to thank you in advance.
Well, thank you, Dr. J. I am on a mission. These kids, there's a wave. There's literally a tidal wave of children that are out there right now who are what I call the alphabet soup kids. Mm-hmm. The kids with ADHD and ASD, which is autistic spectrum disorder, and LD, learning disorder, SPD, sensory processing disorder, all these alphabet issues that are coming up. And I feel like they're not really getting well cared for. They're getting a lot of misinformation from a lot of different places, and I feel like it's my personal mission to do everything I can to focus them and focus their parents and get them in the best direction that they can achieve, their best potential.
Right. And you've been in practice for bumping up against 30 years, so congratulations on that. And you talk about this wave of kids coming in, and we're seeing this. When did things change? Like, where has it been a slow progress, or as you said, a wave? Is it just all of a sudden? What's been your experience clinically?
Yeah, it's fascinating, actually. If you look back at the statistics, 1995 to 2000 is when everything started changing. Okay. When I started in practice, I graduated in 89 from Life, at that time, Life Chiropractic College, now Life University. And the number one child condition that I saw in my practice was ear infections. Mm-hmm. And even though I still see quite a number of ear infections, just did a Facebook video about ear infections last week, that's not the number one child condition that I see now. The number one child condition I see now is some child on the neurodevelopmental spectrum, whether it's ADHD or autism or any of the other alphabet things going on. And it really started in 95. Dr. Larry Webster, the founder of the ICPA, and I had a conversation. He said, Drew, there's something really weird going on. I'm seeing more kids with these diagnoses like autism and ADHD, and this was rare stuff. When I was a kid, autism was 1 in 10,000. And if you look today at the meteoric rise, it started around 1995, 2000, and now the autism rate is at a minimum, probably worse, but at a minimum 1 in 68. Right. And it's not genetics. This can't be a genetic only issue. There's a bazillion different factors, I think, that are going into it. And that's why there's a wave. A genetic problem wouldn't create a wave. It would be a small trickle. Right. This has been like a giant, wall coming at us. And I think that we were totally unprepared and are now kind of backpedaling, and trying to figure it out.
Right. And with your experience of that, like in that 95, 2000, like what kind of things we're changing. I mean, we've seen a lot of links with just in general, like the neurology having toxicity, there's increased stress, there's epigenetic factors with pregnancy. Like, what are the major ones that our parents now, say if you're, in a pregnant and bringing a new kid in, that are ones to look out for?
Yeah, this is a great question. One of my mentors, Dr. Robert Melillo, he's written a number of books. Disconnect the Kids is his most famous. But the book that I'm thinking about related to this question is called Autism. And in it, he introduces something that now, when he wrote it 5 or 7 years ago, it really wasn't very popular and well known, but now it's very popular. It's called preconception. So the whole thought is that he says there's like a neurotoxic world. We live in a neurotoxic world where there's so many things bombarding our kids these days from the time that they're fetuses, so that we have the cell phones and microwave radiations and GPSs and iPads and iPhones and all these kind of things just bombarding kids with, that kind of those frequencies. And we have our food that has been challenged and Monsantoized, and we have our water that's been polluted with chemicals and fertilizers and drug residues and all these things. He calls this like the neurotoxic world. And he says in preconceptive work, what we need to do is we need to examine the mom, and the birth father and put them together and say, what can we do to make the best possible sperm and eggs we can so that we limit the incidence of some of these things happening? Because it's in that first month that the neural tube is developed. And if we don't capitalize on things before the woman gets pregnant, then we may never get a chance to fully combat and create the best possible results.
Right. And then during pregnancy, like after babies can conceive, what are the things that you recommend to your patients to, optimize things?
We call it clean living, which is eating the best foods that we possibly can. And if the mom's breastfeeding, it goes for her, too, making sure she's eating the best possible diet, not just for the best amount of breast milk in terms of volume, but in terms of the cleanest food that is going into the baby, and making sure that their rooms are EMF free. So they shouldn't have cell phones, laptops, smart TVs in the baby's room or kid's room. They shouldn't be. One of my big pet peeves is they shouldn't be on a cell phone for any amount of time at all, except for little blips of time in their first 2 years. Even coming out of the American Academy of Pediatrics, who's stating this, is just not right for their brain development. Their brains develop in a certain pattern, and when we introduce these cell phones that everything is changing very, very quickly, we introduce brain patterns that they're not ready to, their prefrontal cortex is not ready to really receive them, and it really starts scrambling their brain. So those are the kind of things that we talk about, including, of course, getting adjusted to make sure their brain and nervous system are working as good as it possibly can.
Right. And with the kids that you're seeing in your practice coming in, like at what ages are you seeing these kids come in? Are they more like preschool or later on down the line? Are you seeing infants starting with signs of this?
Well, what's very interesting is that Dr. Webster was very, very good at warning me about this. He said it's not just going to be like the typical child that someone thinks about when they think of a child with autism is a child who isn't speaking, right? That's like your typical child. But autism and a lot of these things is on a big spectrum. Melillo talks about this too, where the ADHD and autism and learning disorders, this is all of a spectrum of issues in their brain, right? It's not like it's a separate necessarily issue. It's like there's worsening issues of the brain. And we can even see issues like this starting in infancy. So kids who have latching and nursing problems, we have to eat. It is a necessary thing for a child to do. If they're having problems eating, this is a significant issue that already shows that there's something going on with their brain. If a child is having digestive issues like colic or reflux as a little baby, this is another thing that shows some significant early issues, when they're having troubles reaching milestones, such as crawling or rolling or walking. These are all things showing that something is happening with that little child's brain, that it is not developing in the way it's supposed to. And we really need to, as a United States, as a North America, we really need to start paying attention to this and not wait until the child is 3 years old to make a diagnosis, because by then you're probably a couple of years late.
Right. And I think you hit on a good point that I want to circle back to, is that as we've learned more about these kind of neurodevelopmental issues and disorders, it used to be that we're placing a kid or looking to place a kid on the autism spectrum, whereas now we understand that autism is just part of a larger spectrum. And would you call that spectrum the sensory processing spectrum, or is it neurodevelopmental processing spectrum? Like, how would a parent conceptualize that?
It depends on the literature, what part you're reading. I do a lot of reading of literature and textbooks and journals. So it really, I like calling it the neurodevelopmental spectrum.
Okay.
Because sensory processing is part of that, but it's not. There's also motor processing. So processing, I think, is a key thing. All these kids, whether you're an infant who's having latching and nursing problems, one of the reasons, not the only reason, because it could be tongue tie, it could be a lot of things, but one of the reasons that I see children having latching and nursing problems is because they don't understand the sensory and motor information that their mouth is giving them. So they are literally confused at breastfeeding. They don't get it. And through adjustments and through exercises that we can give them, or the lactation consultants can give them, you can actually turn on these areas that are not exactly functioning at peak efficiency. So that's what I see, is that it's a matter of finding where the challenge is, where the weakness is, and then strengthening that weakness. So that's why I think it's more of a neurodevelopmental kind of issue. But that neurodevelopmental issue, Dr. J, will later on translate to a neurobehavioral issue if it's not taken care of. So one begets the other.
Right.
It's like if we have a little baby who's having, latching and nursing problems, and later on colic and reflux, and later on they're going to start having, let's say the problems rolling and problems crawling and problems walking. Well, there will not be, it's really not a surprise that when the kid is 5, he's now diagnosed with ADHD. When he gets into school, even though it looks like, but he got over the colic, he got over the reflux, he was, instead of nursing, we just gave him a bottle, so everything looked fine, but it isn't fine. And this is based on research from Heiner Biedermann from Germany, who talks about the KISS syndrome and the kinematic imbalances that he calls it. And these kinematic imbalances that happen in infancy, if they're not checked in infancy, will translate to other problems later on.
Right. Let's connect those dots for the parents too, because I think a parent might hearing like, okay, my kid's having latching issues. Does that mean they're going to be, having learning difficulties? And those dots can be connected in that the way that I understand it is, just as you said, in brain processing, that if a kiddo isn't able to sense properly with the lips and the tongue and coordinate that suck, swallow, breathe, that's an indicator that the brain isn't processing information properly, which then doesn't mean that a latching issue necessarily breeds all these other things, but it's the upstream of it is the brain's not processing information from the body and able to execute and send messages downstream from the brain to the body to be able to coordinate those things. And then the problems just keep getting bigger and bigger. Is that a good summary of that?
Yeah, that's very well said. The thing that I think is so important is it's not that if a child has latching problems or nursing problems or colic reflux, they're going to have problems later on as a one-to-one guarantee.
Right.
It's just that we have to pay attention to the signs early. Because if there is a brain weakness and it's not corrected, it might lead to something later on. And rather, what I see all the time, Dr. J, in my examinations of children who have one of these, alphabet soup, quote unquote, issues, is I see this common thread where a child's, just for example, a few days ago, a child with ADHD, 6 years old, came in, boy, really handsome kid, just a cute young kid. But before we take them in the back, I sit with the mom alone because I don't want the kid to hear, all the stuff about him. So we have interns or staff play with the kid up front, or if there's a parent, have them play with them up front. And the mom takes me through the history, and the history is, difficult birth, latching and nursing problems, colic and reflux, ear infections, early behavioral issues. Then everything seemed fine for a bit of time, and then all of a sudden now they're 6 years old and now they're being diagnosed with ADHD.
Yes, I see that
but
all the time too.
Put those two things together.
Right.
And she's like, "Why are we talking about him when he was a year old or at his birth?" I said, "Because those one begat the other." And she's like, "Oh my God, I never thought of it that way. That if there's problems here, they could lead to problems later on. Not a guarantee, not absolute, but we see it enough times that what I try to stress in my lectures and seminars when I talk to parents is don't get freaked out by your child not nursing well, having colic or whatever, and presupposing what's going to happen years from now. Understand that we need to do something now. It's not just a matter like we've had a woman recently say to me, "Oh, well, we couldn't breastfeed because she was having problems nursing, so we just gave her a bottle." That didn't fix anything.
Right.
It fixed the feeding issue, but it didn't fix the brain issue, and that's what we really need to work on. And I think the world is changing. I think the world is now thinking more and more this way because there are enough people out there like yourself and myself and the ICPA really putting all this together.
Right. I mean, just even yesterday, I saw a newborn. She was 3 weeks old, having, stomach issues and latching issues, and was working with them and, talking about the history and the like. And I started talking about all these things that you just mentioned about KISS syndrome and the kinematic imbalances and if you're subluxated. And she then said, like, "Oh my gosh, I need to get my 3.5-year-old checked because her 3.5-year-old had similar issues, but quote, outgrew it." Right. And I think that's what you're saying about like, okay, we couldn't breastfeed because it was too challenging. So we went to the bottle. It eliminated the feeding problem, but it didn't solve the sensory processing. So I think that's why I'm so adamant about checking kids after birth as quickly as possible so we can clear out their nervous system from any birth trauma and even prenatally, so that their nervous system is intact and whole and able to do the amazing development it's going to do in just even the first 2 years. I mean, let alone beyond that. But it's phenomenal how much the brain and nervous system is growing in the first 2 years, and we wanted to do it optimally.
Exactly. And that's what I think is the most important take home to this is how can we optimize each kid's brain and nerve system. So no matter what challenge they're going through, we want to make sure that they come through that first 3 years where brain development is the most critical and 90% of brain development is occurring. Can we give them the best possible foundation so that when they get into school, by the time they're 5 or 6 years old, they'll really be able to have the highest potential that they can.
Right. Well, in that alphabet soup that you see so much of it, like you had mentioned about the ADHD and autism, learning difficulties, all those different elements, like where in the line of things would you, I mean, we talked about like with the latching issue, you want to address that, but especially in the crawling, walking, can you talk about like the cross crawl and its developmental benefits for the brain? Because I've seen a lot of, there's areas in here in San Diego where people are looking at the learning difficulties like being linked to precocious walkers that skipped crawling and start going back into that. Like how can a parent like wrap their head around like how important that kind of tummy time and the crawling is for their brain?
Yeah, great question. The how I describe it in my seminar is I'm talking to you, on Skype through this MacBook Air, and it's got a quad core inside of it. And if one side of if that core is not working, will it affect just one side of the computer, or will it affect the whole computer? And that's exactly what crawling is about. The whole point of crawling of a child going from horizontal to vertical, which is it's like major goal in this first year, is verticalization. As Dr. Biederman puts it, that verticalization, the critical factor is in crawling. We need to actually defeat gravity. So to get on all fours, you have to fight gravity, right? Like a snake doesn't have to fight gravity. It's going to do its commando crawl, its snake crawl on the ground. But in order to go on all fours, you have to fight gravity, and that's a huge brain development issue. So if a child misses that, then they are literally missing like one of the most important things that's going to develop hand-eye coordination and different sides of their brain working at different times. So we'll see a lot of kids who have missed crawling, and we suggest to their parents, let's get them crawling again. Make some crawling games, for them, a crawling obstacle course, etc. The Teitelbaums, in their research back in the late 90s and early 2000s, talked about this motor development as a way to analyze if a child has a neurodevelopmental issue. So looking at these children's rolling patterns and crawling patterns, and patterns of breaking against the fall. Like you're supposed to put your hands out when you fall. Some kids don't. That's a problem. That shows that there's a missed connection. It's a missed reflex. So these are the kind of things that I think are so critical in analyzing a child. So one of the things we do in my office is to make sure that every kid, I see them on the floor, because I want to see what they do while they're there. And, because what I find a lot of other professionals do is that they see the baby in the mom's arms. They never get a chance to see them on the ground interacting with the world. They see them in the mom's arms or in a car seat. And that's an artificial environment. We need to see them on the ground to really know how they are interacting, how they're rolling, how they're crawling, how they're walking, etc.
That's so interesting. I've seen videos talking about the kiddos. It's Brain Highways is the name of the program I was talking about here in San Diego, with helping with 6, 7, 8-year-olds that are showing indicators of learning disabilities. And part of their diagnosis, or not diagnosis, but their assessment, is putting the kids on the ground to do a Spider-Man walk, like keep your belly on the ground and get across the room. And these kids can't do it. And they're not even crawling. They'll get up and they'll walk and like in a circle, crawl in a circle, because one side's not firing in the same way. And it really opens the parents' eyes of like, whoa, like why can't my kid crawl? And then developing in a lot of different ways with, as you were talking about, with different obstacle courses and kind of repatterning the brain, there's huge jumps, not just in the learning difficulties, but behaviorally. And I think that's something I want to touch on too, is like how that lack of brain development, say, like how does that contribute to behavioral issues later on down the line?
Well, if you can imagine, like we talked about with the MacBook having 2 different cores, Dr. Melillo kind of talks about this too. The brain is 2 sides. It's a left and a right side, and they're supposed to open up like a flower, right? Like if you imagine a flower coming, out from, it's springtime here in Atlanta, so we see the crocuses and the tulips and stuff, and they come out and then they open up, and they open up pretty symmetrically, so that the left side of the flower looks relatively like the right side of the flower. But sometimes that isn't the case, and if one side of the flower opens up only partly, then you sort of have this, this flower that isn't working as a unit. And it's the same thing with their brains, that if one side of their brain has, for whatever reason, some sort of a deficit, that left brain or right brain isn't working the way it's supposed to, and it's not growing symmetrically, then as they get older, that asymmetry will become more and more apparent. And depending upon what side of the brain has that asymmetry will depend upon what sort of issues you're going to see manifesting from that, right? So have a child, as an example, who's got a left brain deficit. The left brain is the brain side that's very analytical and computational. So that left brain is the side of like, if there is a deficit, you'll see kids with some sort of reading issues or math issues or that kind of stuff. Whereas the right brain, that's more like the artistic, creative, outgoing, extroverted kind of side. And if there's a problem on that side, then there might be more of the kids on the autistic spectrum kind of challenges. That's very oversimplified. But That's basically what we see, is that wherever this brain imbalance is later on, now it will start to manifest more and more. So the point of what we do in our practice is, aside from the chiropractic adjustments, is we assess them neurologically, like a brain-based neurological assessment, to make sure that we can start pinpointing the problems and then start giving these kids exercises to help strengthen those weaknesses.
Right. Because it's one thing, as we do with chiropractors, open up the channels and allow the brain to function more optimally. You have to use it and fire those pathways over and over again, which is going to happen just as a kid's like crawling around and walking. But at the same time, like having those pathways be reinforced so it anchors in is so important.
Absolutely. So what we tell our patients is the adjustments are to help make sure that channel is open. The brain and nerve system is working as good as it can, like you're plugged in to the wall, so to speak. But when you go home, what you're doing is you're optimizing and maximizing these adjustments. So the adjustment doesn't stop when you leave the office; it starts then, and then you add to it when you do these exercises. You make it work even better, so that the kids who get the best results are the ones who not only are doing the exercises and getting adjusted, putting those two things together, that's what we really see as an amazing change.
Right. And in our last couple minutes here, I definitely want to touch on, we talked about this before we started, about something very specific around like pandas that's going on right now in Pan, because it's, as you were saying, like, it's coming up more and more. It's, you had said it's not popular, but it's something that is coming up more and more in parents' attention. So I really want to touch on that before we end. So what do you have to share about that?
Well, several years ago, we started hearing more and more about this thing called PANDAS, which is an acronym for Pediatric Autoimmune Neuropsychiatric Disorder Associated with Strep. We started seeing this because we had kids who were coming in that were what we would call neurotypical, and all of a sudden they would get a strep infection, and then these kids their personalities would change. So as an example, we're dealing with one particular case right now. Little boy, happiest little kid, rambunctious, etc. He got sick recently, and then all of a sudden his personality changed, and now he's like this clingy, anxious, scared kid with these strange, like, OCD-like tendencies and little tic tendencies, and it's like, what happened? We correctly identified, I think this might be PANDAS, because I remember him having the strep infection recently, and it was analyzed, and that's exactly what it was. And we've seen this now twice in the last couple of months, and 3 times in the last 6 months, where this is happening more and more. So I think this is becoming something of an issue, and now they've even changed something. They've adapted the name to PANS, which is Pediatric Acute Onset Neuropsychiatric Syndrome, because it's not just strep. They found it's some kids who've had certain strains of pneumonia and other kinds of viruses can also trigger this. These sort of issues where we get these OCD-like tendencies and tics and odd behavioral changes and clinginess and anxiety. So it's like this part of the wave, right? It's just another alphabet soup thing to add to the picture, right, where we have these things and now we're adding these things to it as well.
Right, and it's similar kind of onset or abrupt with like the second type of autism.
Correct. So there are 2 essential categories of autism. There's primary autism, where a child from early on starts to develop issues, kind of like we talked about before, this early issues that we've already noticed that we talked about, and then later on, by the time the kid's 2, there's no eye contact and not much communication, and so they just went right up into autism. But then there's what they call secondary or regressive autism, where you like this boy who has this neurotypical pathway for 6-7 years, and then all of a sudden just plummets and has a major change because of some kind of thing, whether it's a streptococcal infection or pneumonia or some other kind of insult to his little nerve system. There's 2 different pathways that we're seeing, and we have to be able to identify primary versus secondary to really give the best possible outcomes.
And in these couple of cases you've worked with pandas, like, is it reversible?
I don't like the word reversible, but we've seen significant improvements.
Okay.
And it's got to be a multifactorial kind of approach to this, because these kids need to find the pediatrician in their local areas that will work with them with this kind of situation, and not, just kind of push it aside and say, oh, that's, hearsay and nothing. So they need to have, several different, players on their team to work with them, chiropractic, nutrition, and a pediatrician to help manage some of these infections that are still lingering. It's kind of like I mentioned in this Facebook video. It's kind of like chickenpox and shingles. The way you get shingles is you get chickenpox when you're younger, and then you have the stress, and now shingles develops. It's the same thing with pandas, that you have this strep infection, this other massive infection that really hit them hard, and it never went away. And then something turns this stuff back on, and it happens to be in this situation that it's affecting, them behaviorally.
Right. Okay. Well, thank you for sharing that, because I know that's something that a lot of parents are hearing more about and wondering about. So thank you for answering that. Well, with our, in the last minutes, tell people how they can find your information, more about the work you're doing, or is there any place that you'd like them to connect with you if they have questions?
Sure. My three favorite places, Dr. J, is number one, my podcast. I have a podcast that I talk about topics like this called Chirocast.
Yes. Great podcast, people.
So that's been an exciting addition the last couple of years. My website is theadjustment.com, which has a lot of links to a lot of different things. Probably the central place for everything. And Facebook is always a great place to connect. Rubin Family Chiropractic is my Facebook. At Rubin Family Chiropractic is how we get to us on Facebook. Okay,
great. And I'll make sure I have links to all three of those things, to your podcast, your website, and the Facebook page, so people can get in touch. So what's the major take-home message you'd like the parents listening to this to get from our conversation today?
I think the major take-home is from, if any of you guys have read books from Dr. Norman Dodge out of Canada, he talks about neuroplasticity. And neuroplasticity, in very simple terms, is essentially saying the brain can change itself, which is the title of his book. The brain can change itself, and anything is possible. So we have seen children who are having latching and nursing problems and colic and reflux, and then they get adjusted and do exercises, and now they're 6 or 7 and they're totally fine. We've seen kids who are autistic and are having all kinds of trouble at school, either not communicating or communicating in a very odd way, which is very typical for this kind of child. And now they're completely mainstream. We've even had one child who no longer has the diagnosis of autism. So anything, neuroplasticity says anything is possible. With the right input and the right amount of input and the correct frequency of these inputs, I think anything is possible. And that's the take home, is that if you have a child who has these kind of issues, it is something that absolutely can be worked on, and who knows what the outcome will be, but they don't have to stay the way they are, that things can change, and it's just going to find the right team to help them change.
Right. There is hope, and something can be changeable about it.
Correct.
Good. And what about for the little baby that might be listening? What kind of words of wisdom would you like to whisper in their little ear?
I think in the same vein that anything is possible, and don't believe a label, and don't be put down by what someone might think about you or what someone might say you can or cannot do, because I have seen in the 30 almost years of practice that I've been through, I've seen such amazing changes. And sometimes I really believe this. Sometimes it's because that little kid just has it in them, right? It's just it's in their makeup that they're really, really tough. So, just hang tough, be tough, and know that you got it. You got it.
I love it. Dr. Rubin, thank you so much for being here today. It's been a pleasure talking with you again. I love meeting you in Washington, D.C., but I'm glad we got to share the podcast space. Always love talking with other podcasters.
It was a great talk, and I really am excited about what you're doing out there in San Diego, and you keep up the good work.
Thank you. I will. You too.
I will.
Hi, it's Dr. J again, and I want to thank you so much for listening to the podcast. It's something I really enjoy doing, and I, as a parent, learn a ton from these experts coming on and sharing their wisdom, so I hope you're getting a lot out of it too. And I want to share something else with you. I've created a guide called the 40 Ways to Connect with Your Baby During Pregnancy. It's full of simple things you can do on a day-to-day basis that will help strengthen that bond that you have with your baby. It's a free download. You can go to my website at drjwarren.com/40ways and just enter your email. I'll send it right to you. You can download it and start working on it right away. All of the research that I'm learning in the fields of epigenetics and attachment parenting is showing that the more bonded you are during your pregnancy with your baby, the better the birth is going to go and the better parenting is going to go, because you have that strong foundation, a strong connection to build upon. So go again to my website. It's drjwarren.com/40ways and get that free guide. And again, thanks for listening.